We know members of the media cover their communities with the intention to make them a better place. But when it comes to coverage of addiction, many of us are missing the mark. Media coverage often doesn't reflect the complexity of addiction and recovery, and rarely presents solutions. If you are a journalist reporting at any level, here are 5 things you can do to improve your reporting on addiction. Number 1, person-first language. An addiction is merely one aspect of a person. Terms like addict or junkie dehumanize and reduce these individuals to just their disease. Don't reduce people's stories to something simplistic or put them in a box. We've already seen changes to the language we use to talk about disability, and the same can be applied when talking about addiction. For example, instead of using those harmful terms, say person with a substance use disorder or person with an opioid addiction. Person-first language promotes humanity in your reporting. Number 2, addiction is a disease, and our reporting should reflect that. Addiction is a chronically relapsing brain disease. It's also a public health issue. And while science is advancing, there is currently no cure. There are, however, effective and life-saving treatment options. To help your readers better understand the disease aspect of addiction, interview addiction medicine providers and experts that adhere to evidence-based approaches to treatment. If there aren't any available to you locally, rely on national resources. Remember, there are many paths to recovery. For some, medication is an important part. Others may rely on groups and peer support. But our reporting should never shame people for the treatment that works best for an individual. Number 3, balance fact and opinion and determine when opinions can be dangerous. Using quotes or opinions that are not based on scientific, medically proven evidence, especially for the sake of, quote, balance, is harmful. While we have a duty as journalists to report when a public official says something offensive in any situation, when reporting on addiction, we risk perpetuating harm and discrimination. If it's necessary to include false or harmful statements made by a public official, first, provide the necessary context. Then, include facts from an expert, research article, or government source immediately afterward to discredit their claims and prevent further harm and discrimination. Number 4, be thoughtful about headlines and image selection. Sure, jolting headlines and stock images of drug paraphernalia are certainly ways to get clicks on your website, but sensationalized headlines and images further stereotypes and create barriers to care in our communities. They can also be upsetting for people with the disease or people in recovery. Instead, use photos of treatment facilities, your actual sources, or the experts of the story you are covering. Humanize your subjects instead of exploiting them. Look for images and use words of hope and recovery, and be sure to ask for permission before including or taking pictures to respect the privacy of clinic patients. Number 5, provide resources for treatment. Coverage that doesn't have a medical and public health perspective perpetuates stigma and discrimination. We can easily move beyond those harmful narratives by focusing on and providing our audiences with information about treatment and the resources that are available. And use this sentence at the end of any story on any platform to point people to help. Recovery from addiction is possible. For help, please call the free and confidential treatment referral hotline or visit findtreatment.gov.